Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, Public Health on Call goes back to school. Erica Johnson and Lily Mendelson are school nurses at KIPP Baltimore, an open enrollment charter school that serves pre-K to 8th grade students. They invited Dr. Josh Sharfstein over to the Health Suite to talk about how the first week of school looks from their vantage point. Let's listen.
Nurse Erica, Nurse Lily, thank you so much for inviting me in close to the first day of school to hear about how things are going for you as school nurses. But I wanted to start by asking you to introduce yourselves to our audience. What has been your path to being a school nurse?
Thank you for joining us. My name is Erica Johnson. I am a nurse and have been a nurse for 17 years now. For the first portion of my career, I worked inpatient at Johns Hopkins Hospital on the infants and toddlers med-surg unit for about 13 years. And following COVID and being fairly new to motherhood, I decided to make a change and wanted to have a different path of nursing, which also aligned with my passion for education. I've now been here at the Rails Health Center going on 4 years, and it's been a different journey of nursing, which I think brings so many people to nursing. It's just the ability to be so flexible. So it's been great.
Nurse Lily?
Yeah, hi. Thank you again. I, like Erica, worked inpatient before I came to KIPP. This is my 7th school year here with Rails Health Center at KIPP. Prior to that, I did work inpatient as well, also at Johns Hopkins on the school age and burn unit. Kind of realized that school nursing was this really amazing, particularly here. We have such a unique program. But really, truthfully, any school nursing is this amazing kind of opportunity to work at the intersection between healthcare, education, and really public health. So it's been an amazing opportunity.
So I'm picking up some first week of school energy. What is that like?
Yeah.
What is that like for you? What does it feel like to, summer's behind you, the kids are back. How does that feel?
Of course, no one wants summer to really come to an end, staff and students included, but it is exciting. First week of school, we love seeing our kids come back, hearing what they did over the summer. Everyone has fresh uniforms and they're bright and they're excited and their hair is done and haircuts. And it's nice to meet and greet our families as well. It's a lot of nerves of approaching new grades for families that are new to KIPP. Of course, our pre-K, we have little ones with us, 4 and 5-year-olds, and seeing them adjust to being in such a big building. It's a fun time. It's an exciting time. It is a little bit of a nerve-wracking time, of course, with paperwork and all of those things. But it's great. This first week has been wonderful.
Nurse Lily, what are the key things you are thinking about in the nursing suite here? What's top of mind from a health perspective?
One thing for us is certainly keeping track of broader trends in kind of infectious diseases, communicable diseases. This is our 5th day of school this week, and we've already sent home at least a couple kids every day, either febrile with fevers or vomiting. So various other things. We've had parents come in reporting their children have been diagnosed with COVID. So we are already kind of thinking about that and making sure we're giving appropriate guidance to people, connecting them with their healthcare providers, things like that.
So you're essentially saying, okay, we're starting school. Just how much illness is out there in the community
Correct.
That we're going to start seeing? Yeah,
absolutely. I think and we often see trends that are statewide, even local trends end up kind of showing up in our school population as well.
Right. Well, what else are you trying to figure out about the students who are here this year?
Yeah, so a huge piece of what we're doing is making sure that we are firstly informed and secondly prepared to take care of all of our kiddos. So with school nursing, you're responsible for the health of every child in the school. That is our job, to take care of every child in the school. It's part of their public education. So we want to make sure we are aware of what kids are facing. Here at our school, we have kids with type 1 diabetes. We need to make sure we have orders for them, paperwork from their doctors. We need to make sure we have all the right supplies, make sure they've been to their endocrinologist recently so that they're looped in and connected with their specialist. We have kiddos with sickle cell disease, hematologic, other bleeding disorders, all sorts of things. And those are just the returning kids. And then we have new students who we often are learning about. I feel every year we learn about a new kind of rare or less common condition that quickly we have to learn about and then make sure we understand how that affects their education.
Thanks. Nurse Erica, there are certain conditions that you might be thinking we've got to make sure they're under control in order for the kids to be able to be successful in school. What's on your list for those things?
I think for me, the biggest one is asthma. We have a huge population in Baltimore City, number one, and then in our school population of children who are living with asthma. As we approach season changing, we've already had a couple cool mornings this first week, which is surprising for August. And as we approach the cooler months, that is a lot of time when many of our kiddos begin to suffer from triggers of their asthma. So a big push this first week and the first few weeks of school is always ensuring that we have rescue medications for our children who are identified with asthma, making sure that we make connections with families and having medication and, like Nurse Lily said, orders and paperwork to keep them covered. And again, as we know, there already been some illnesses out. We have already sent children home, so we're already kind of have our antennas up of what our fall is going to possibly look like.
Nurse Lily, what's the back to school situation for vaccines for you?
Yeah, so that's a huge part of getting ready for school. And honestly, a lot of that we do over the summer in preparation in the weeks before the kids are coming back. We need to make sure that everybody's up to date on their vaccines that are required for return to school, which are typically at school entry, which is either pre-K or kindergarten here, and then 7th grade for the 11-year-old shots. So kids are not allowed to be back if they don't have those. So we are doing a ton of outreach. Honestly, we start actually in the prior school year when they're in 6th grade, we start reminding families like, hey, your child's going to need these.
And then this first week, with the parents' permission, can you give the vaccines right here?
Yeah. So again, we are super lucky to have our health center here. The great news is that we can give vaccines to the vast majority of kids here in school just to keep them here and learning.
Let me ask you this. You've got more than 1,000 kids in this school. How do you want them to think about your office and you guys? How do you want them, to be introduced to school nursing and feel about you so that they can come when they need you?
Yeah, I think that's a really interesting question. I think the biggest takeaway we want kids to have is that we are a safe space where they can come to feel better. It's also a good introduction to the world of healthcare. And, sometimes we do have to talk about with whether it's a skinned knee or something, we talk a lot about being brave and, this hurts now, it won't hurt forever. We want to build a little bit of resilience in our kiddos, but also ensure that this is a space where they get the comfort and support they need. We want to walk the very fine line between being a fun space and being a safe space, because ultimately kids are at school to learn. So every day we have multiple kiddos who come down and really just want to spend time with us. And truthfully, we don't want to be angry at them for that, but we try to get to the heart of the matter pretty quickly. And if that's what they need, maybe one of our things, I don't even know how many times a day Eric and I will say, do you need a hug, a handshake, or a high five? And kids are really great. Even our oldest 8th graders often respond well to that and kind of get the support they want from that. And then we're really honest. If you're here because you don't want to be in class, let's take 5 minutes and then let's go back, because your parents sent you here to learn. So we want you to do that. And if you really don't feel well, then this is the place to be, and we're going to work to help you feel better.
Anything you'd like to add, Nurse Erica?
I just think on top of that, one thing we stress to our kiddos is we know that healthy learners are the best learners. So if you aren't feeling well, you aren't feeling at your best, you aren't going to learn well. So we are the place that you come so we can try to get you better so that you can learn well.
Let me ask you about some things I'm seeing in the space here. I see one big set of drawers that say 1st grade glasses, 2nd grade glasses, 3rd grade glasses, all the way up to 8th grade glasses. What's going on here?
So we do, in addition to kind of state mandated vision screening services, we are lucky that we are able to offer vision screening for the grades that are not normally screened, and then have a lot of partnerships, whether it's Vision for Baltimore or another partnership, where kiddos can actually get glasses, and they get 2 pairs. And one is for them to keep at home and wear every day. And then we keep a backup pair here, because like Erica said, healthy kids are the best learners. And that includes vision, right? So if a child is not able to see the board or see their Chromebook or even see their teacher's face, they're really not going to be doing their best at school. So we keep a backup pair here. If something were to happen, we're able to say, okay, let's see. Now you have this new pair of glasses on. You can see the board again. So let's get back to class and back to learning.
Okay, Nurse Erica, you're going to show me around the walls of where you work. Tell me what we're seeing here.
Okay. Our biggest goal when we have students enter our space, we want them to feel welcome. We want them to feel comfortable. Many times they're not feeling well, clearly, because they're coming to the nurse's office. So we want them to feel that we're in a safe space, that they can be open and share, and we're going to do our best to care for them. So we like to keep it bright and light. Those are the key words, bright and light. And our first stop here on our wall, I created this bulletin board. The goal was to make it very bright because we want children to realize that's also part of KIPP's model is our bright values, which our children are very familiar with. Throughout the school, we all focus on various values, and we want children to know that they are unique, smart, talented, they matter, that when they're here, they're going to be taken care of, and that this is a safe space. So it's welcoming, it's colorful.
I would say if the mission is bright and light, it's mission accomplished here. There's a lot of light here.
Yes. And then we also get into last year for School Nurses Day, our kindergarten and pre-K students did a wonderful job of creating all of these nice pieces of artwork to celebrate us. So we wanted to make sure we put that on display.
I'm going to make you read this one.
Yes. Hands down, the best nurses in town. And they made sure, again, bright and light, using all these wonderful colors to have their handprints on there.
Nurse Lily, Nurse Erica, this has been really fun. Just the first week of school vibes here are picking up my mood quite a lot. but also hearing about all the great work you're doing with the kids here. Any messages for people who don't know much about school nursing? As you're, rolling up your sleeves for another school year, what do you want people to know about all the school nurses out there?
Well, I think COVID pandemic did kind of open some people's eyes to the reality of school nursing, that it is more than Band-Aids and ice packs, though we do plenty of that. I will not say that's not something we do, but we are kind of the actual healthcare people in a school. And this is hundreds of people. This is an entire population that we want to keep safe and healthy. And we will do, I don't want to say anything, but almost anything to ensure that that's the case.
I think one big thing that, in addition to what Nurse Lily said, that's very common, right? Everyone thinks about Band-Aids and ice packs, but not just direct patient care for our kids, but we focus on the whole child, especially being here in a school. We know that that is what the children are coming for. They're coming to school to learn and be educated, but we want to teach them about all things, create active and strong future citizens of society. And that's working from their mental health, their physical health in all areas. So not only are we here to heal children and help them and make them feel better when they have skin knees or give them an ice pack, but also making sure that they feel whole and well while they're educating.
Well, they are really lucky to have the both of you here. Thank you so much.
Thank you.
Thank you so much. Dr. Sharfstein, Josh, do you need a hug, a handshake, or a high five?
I'll take a high five.
All right. And then would you like a cool Band-Aid for the road?
Absolutely.
All right. Let's go pick one out. Band-Aids and ice packs thing, but...
All right. We've got quite an array of Band-Aids here. Can I pick this one? How would you describe it?
Yeah, we call that our Moon and Stars selection. It's pretty popular. It's very gender neutral, popular with everyone. Good size. Looks like it should glow in the dark. It doesn't.
Well, I like it anyway.
Great choice.
Thanks so much, Nurse Lily. See you
You're
soon.
welcome. Yeah, come back anytime.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.